We're now going to look at the transmission of water-wash diseases. These water-wash diseases are caused by people having insufficient volumes of water for personal and domestic hygiene. And some diseases which can be transmitted by this water-wash route include typhoid, cholera, shigellosis, enteroviral diseases, giardiasis, cryptosporidiosis, all in fact of the diseases which we've just described as being waterborne. So this leads to a very important question. Are these diseases transmitted by a waterborne route or by a water-washed route? And the answer to this question, in low-income communities in developing countries, water-washed diseases are likely to be much more important than waterborne diseases. Why is this? Basically, because the pathogen has to get from the anus of one person to the mouth of another person. That is to say, both waterborne and water-wash diseases are fecal-oral diseases. The exception to this are the skin and eye diseases, which we'll discuss in a minute. So this slide shows some examples of fecal-oral transmission routes. The feces of person A can get on that person's fingers and into the mouth of a second person. Picture, for example, two small children playing in the garden. They frequently put their hands in each other's mouths. The second route, the feces of person A gets onto that person's fingers, onto the fingers of somebody else, and into that second person's mouth. People shaking hands, for example. The third route, the feces of person A get onto that person's fingers, into food, and then into the mouths of several other people, and this is illustrated by a mother or an elder daughter preparing the meal for the family. Or the feces of person A can get into the water and into the mouths of several other people. Now, the first three transmission routes are water-wash, these very direct transmission routes, and the fourth is the waterborne route. Under conditions of water scarcity, the water-wash routes are the most likely, and the waterborne route the least likely, although it's still possible. For example, if we have a shallow well too close to a shallow pit latrine. This leads to a very important question. Which water supply improvement is likely to have the greater impact on health? Do we improve water quality or do we improve water quantity? This is really a fundamental question. If waterborne diseases are actually more commonly water-washed, and in developing countries they almost always are, then improvements in water quantity will have a much greater health impact and so be much more cost-effective than improvements in water quality. And this means, for example, in poor rural areas, investments in a water treatment works, which is an improvement in water quality, may not actually be a good investment. However, if the water quality is very poor, then disease transmission can be reduced by very simple household-level treatment systems. For example, very simple filtration, including filtration through several layers of old sari material. This has been shown, for example, to reduce the transmission of cholera in rural India and Bangladesh. Diarrheal disease is very, very common in developing countries and indeed the world. And this slide shows the incidence of diarrheal disease in the year 2000 by region and by age group. The slide shows that most diarrheal disease occurs in the under fives in both industrialized and developing countries. And the incidence in adults in both industrialized and developing countries is much, much lower. Even so, in industrialized countries, adults have an incidence of between 0.1 and 0.2 per person per year. That's to say a 10 to 20% chance each year of becoming ill with a diarrheal disease. And it's a bit higher in developing countries, 0.4 to 0.6. But the really serious effect is on children, the under fives, because it has an effect on their cognition. Repeated diarrhea, combined also with a heavy parasitic infection in infancy, that's to say under 12 months of age, leads to stunting, which is a medical term for low weight for age, and very importantly, to poor cognition in later childhood. When they're about 9 or 10, they're not able to think as well as those kids who did not have diarrhea. And this has a huge effect on their learning, but also in later life on their employment prospects and their contribution to economic development of their country.